going to do a demonstration. I'm going to demonstrate how we use our laser. This is the Sciton Laser. It can be used for a number of different purposes, and I'm going to show you exactly what we do for each treatment. So if you look here, let's see, there's the main screen. There are basically three options. There's a 1064 nanometer clear scan, 2940 nanometer contour, and the 410 to 1200 broadband light. We'll start with the clear scan, which does hair removal and vascular lesions. I'm going to change this handpiece here. Press that, there we go. So that will load. And now you see there's an option for hair removal and vascular or hair. I'm going to select that one. It's going to confirm or acknowledge that the correct handpiece is attached. That's what we have here. I'll say yes. And this is the handpiece that we use to treat veins, usually on the legs. So it goes right on the skin, and then there's a dot that points to it. When we hit it, it just zaps the vein. That's how we do that. And on here there are a lot of settings. We can adjust the spot size, or actually it affects the pulse width, the duration of time that the laser is on, based on the size of the vessel. I can adjust the speed at which it does pulses, one after the other, the energy settings, or the fluence. Those can be adjusted. There's also another handpiece that can be used, which is a larger spot size for the larger and deeper veins. So that's that one. This can also be used at a high repetition rate for skin tightening. It basically goes back and forth on the skin. That heats up the skin. Now going back to the main menu, this goes back to here, and I'll go back one more. Next we'll look at the contour. Now for that, I will change the handpiece to the micro laser peel scanner handpiece. This is the most common handpiece we use on the contour. So if we press that one, it will go there, and then it will load up. Sorry. So here we have some options: micro laser peel, resurfacing, profractional, and single spot size. The micro laser peel is what we use most often. It will remove a thin layer of dead skin cells. Resurfacing does pretty much the same thing. The profractional uses a different handpiece, the profractional handpiece, and that treats a fraction of the skin surface instead of treating 100% of the skin. And then we can also use this handpiece to do single spots. For example, if we have just a single spot that we want to get rid of, we can do that. Now I will show you the micro laser peel. When we press that, now here's the screen with the micro laser peel. Here on the left, I can adjust the depth, how deep it will remove the dead skin cells. So we can go as low as 4 microns and up to 45 microns. So to get an understanding of that, 10 microns is the thickness of a sheet of paper. Typically we go anywhere from 4 to 10 microns. 10 is a nice treatment. You'll get a good result. Usually you want to do multiple treatments. And as you can see on the right side, you can change the spot size of the handpiece. So you see this is a medium. We can do it low. It will show a small spot. You can't see that there. There we go. And then we can make it bigger. It'll be a bigger spot. I wonder if we look at it on the wall now. So that's that. This one we also have an attachment for the smoke evacuator. So this connects to here, and when we do the treatments we can turn on the smoke evacuator, and that sucks up the plume that's formed from the dead skin cells. This treatment takes a few minutes on the entire face, and it's really easy. We combine this with a lot of IPLs, with the profractional. It's a great treatment, very similar to a microdermabrasion or a chemical peel, in that it does remove a thin layer of dead skin cells to make the texture softer and smoother. But it has the advantage that, unlike a chemical peel where you apply a peeling solution and then the skin peels off a few days later, this is evaporated right away, so you don't have that peeling. And you don't have the redness associated with the microdermabrasion because there's no actual abrasion, it just evaporates the skin. So next, I'll show you the broadband light application. This is one of the most versatile applications on this system, and it makes this system very versatile. As we already discussed, we can use the 1064 for laser hair removal. We can use it for leg veins. We could use it for skin tightening. We use the second application, the contour, for resurfacing, whether it's a full surface peel, fractional laser treatment, or it can do single spot sizes. Now, this is the handpiece for the BBL. It's an IPL for a photofacial treatment. You can see this has a large spot size. This is one of the largest spot sizes that is available for IPL devices. That allows us to treat a large surface area at a fast rate. Also, the repetition rate is very fast. It does about 1 pulse per second. That allows me to do a full face in just a couple of minutes. Usually what we do is I decrease the settings so that it's more safe, and I do multiple passes. So this allows for increased safety, faster treatment, more comfortable treatment. There are a lot of things that we can adjust. We can adjust the fluence, the strength or the energy, how strong it goes. Typically we'll start conservative the first time and then we'll go stronger. The time or the pulse width can be adjusted, and that will affect how long the laser is on. That can be adjusted from one application to another and based on one skin type to another. Usually darker skin types are more sensitive, so they need longer pulse width. Also, the temperature can be adjusted by 1 degree Celsius. That makes it very versatile. Colder temperatures are great for more conservative applications, such as treating darker skin types. Now, this does have a lot of different filters that can be changed. This one is the ST filter. Okay, that's used for skin tightening. It can be changed. It's very easy. We just take it out and put in the next one, and the device detects which one is in there. So the ST filter can be used for skin tightening. It uses an in-motion technique that heats up the skin, stimulates collagen. It's also great for redness, fine lines, and large pores. So that's a great treatment. We can use the 420 filter. That's blue light for acne settings. There is a yellow or 515 filter, which is great for photofacials on fair skin types. The 560 is a higher filter that can be used for redness or for photofacials on patients with medium skin types. For darker skin types, we can use the 590 filter, which is more conservative, or even the 640 filter here, which is also used for laser hair removal. So this can be used for laser hair removal. The other applications that we have on here is we have a smoothie adapter, which goes on just like that. It's magnetic, so it sticks on, and that allows us to gently move the device back and forth on the skin without having the sharp edges, which can injure or scratch a person. We also have a smaller square adapter. So we said this is a large handpiece or a large spot size on the handpiece. For sometimes we want smaller areas. Some people, for example, have a small forehead, so this doesn't fit. We just snap on this adapter, and it's basically 1/3 the size, so it allows us to go into small areas. This can also be used by just basically reducing the size of the spot by 1/3, and that reduces the pain. Some people have discomfort, so we just use a small spot size and do 3 of them. 1, 2, 3. It takes a little bit longer. There are more pulses, but it can increase the comfort. Usually with the settings we have here, that's not even necessary. And finally, this is the small spot adapter. So if you have a single spot, so that was the last one, the spot size, the small spot size that lets you do a single spot. It can also be used for veins. And back here I'll show you the smoke evacuator is way down there. Don't even need it. On the other side we have our Zimmer chiller. That device blows cold air onto the skin when we are doing laser treatments. That makes it much more comfortable. So that's an overview of the Sciton system. It does have a lot of applications, as we discussed. It can do laser hair removal, it can do skin tightening, it can do veins, it can do leg veins, it can resurface the skin, get rid of the dead skin cells with a micro laser peel. It can do fractional resurfacing for deeper collagen stimulation. It can do single spots. It can be used with the IPL to treat acne, dark spots, redness, all of those things, as well as skin tightening, and it has a lot of versatility. We have the small spot sizes, we can adjust the filters, we can adjust all the settings for patients, and we have the smoke evacuator to get rid of the dead skin cells, the plume that comes in the air, as well as the Zimmer, the cold air. That will help keep you comfortable. Let us know if you have any questions. If you'd like to see other things, please let us know. Also follow us on all the social media. We are obviously on Facebook as well as Instagram. It's A_E_skin. On Snapchat, it's AE_skin. We're also on Twitter, YouTube, Yelp, and Real Self. And I have my weekly blog posted on our website. Thank you again, and we'll see you next time.